My name is Kirsten Larsen. I'm a journalist at the Danish Broadcasting. Being healthy, having a chance to make decisions impacting on your own life, being reasonably secure. I think inequality has to be one of them, because inequality means some of the lucky ones, like you and me on Earth, have at least our chance of living a healthy life. But I guess in the coming years we'll have to look at ownership in the world, ownership of land, ownership of access, ownership of work and means of making an income. And of course, ownership of money and assets means a lot. Another one could be climate change, environmental issues. They impact on everything. Environmental aspects all over that impact on our nutrition, on our health, basic health. So climate change, environmental issues would be another one. And for the third one, I think knowledge. We know far too little about what's happening, and we have access to information, part of us, but we don't use it. I think knowledge has to be, broadened up, and definitely has to acquire better quality. I have to say it again, inequality. I think so, because the world is so divided and there's such a great cleft between the haves and haves not. So I think it's the most important challenge. It would be so easy to say climate change again, because it's one of the biggest challenges and it's one of the biggest topics. The third one, I think, would be security. In some countries, being secure from war, just living in a safe surroundings, would make an immense impact for their health. In affluent countries like this one, feeling secure in your job, in your family, in your way of life can be very, very important as well. It may sound easy, but I don't think it is. You're going to get bored now. Inequality, I think. Getting a bit more equal distribution of resources, of chances, of influence. I think it's the key to most aspects of life. The 85 richest persons on Earth owns just as much as the lowest 3.5 billion people. That's staggering. But it's also inequality in your ability to decide for yourself, make decisions that affect your own life. It's inequality in health, definitely, in access to health, and in survival, in a lifespan. So it's on all levels. Definitely. But we might call it something else.